Hello, good evening, guys. Welcome to the live broadcasting of Erufu Care, the online community medical support network. I'm Shireen. Few things are as startling or gut-wrenching for a couple as infertility. It can feel like the end of the world, as if your hopes of starting a family are completely dashed. But that isn't always the case. Thanks to the miracle of the modern medicine, fertility specialists are able to help many who wish to be parents finally bring their little bundles of joys into the world. I'm glad that today we're able to invite again the obstetricians and gynecologist Dr. Chee Hoe, the healthcare partner of Erufu Care, to give us a sharing on how couple can make dream into reality through assisted reproductive technology. Welcome, Dr. Dan.
Hi, good evening, everyone. Thanks,
Good evening,
Sherry.
Dr. Dan. Yeah.
Thanks, Erufu.
Okay. Before Dr. Dan have to start for the sharing, I shall give a brief introductions of Dr. Dan. Dr. Dan obtained Master of Obstetrics and Gynecology in University of Malaya. In 2017, Dr. Dan is a professional trained physician of the Indian Academy of Obstetrics and Gynecology, and in 2018, he has also obtained the Diploma of IVF and Reproductive Medicine in German, UAE. Dr. Dan is a member of the Malaysian Society of Obstetrics and Gynecology, member of the Royal College of the Obstetrics and Gynecology, and member of the World Association's Laparoscopy Surgeon. No further delay, I shall pass the sessions to Dr. Dan.
Thank you, Sharon. Let us bring you to the live talk, making your dream into reality through the assisted reproductive technology. All right, we shall not longer delay. All right.
And share the slide.
Okay, I'm Dr. Tan. I'm from Ever Link Fertility Center. This is my team. We are the first branch of Ever Link Fertility Center in Malaysia. We are the international standard of fertility center, include Macau and China and Hong Kong. This is our center. Okay, it's full. It has a full facility of IVF technology. All right. Just want to start with human reproductive organ and abdominal organ. We have kidney, ureter, all right, liver, gallbladder, stomach, and spleen. Here is our large intestine, small intestine. Our focus today is the reproductive organ of the female. This uterus consists of two fallopian tubes, two ovaries. All right. Inside the uterus is a cavity. This cavity is where your baby is placed normally. All right, this is a side view of the uterus, and you can see that the uterus inside is empty. You have two fallopian tube, two ovaries. All right, this is the ovary, this is the fallopian tube, and this is the primary, where it can actually is the end of the fallopian tube that used to pick up the ovum or the eggs. This is the uterus, fallopian tube, and two ovaries. This is a side view. You can see that this is the back, this is the spine. All right, this is the front. This is our skin, fat, stomach. In front of the uterus is the bladder. At the back of the uterus is a bowel. Right, this is the uterus, bladder, and bowel. This is our operation view, laparoscopic view, keyhole surgery. This is the bladder, uterus, and bowel. All right, this is a side view. All right, when you put a speculum, if you do a pap smear, this round organ is actually a cervix. All right, this is a side view of this lateral view. All right, this is our external genitalia. It consists of labia majora and labia minora. Here is the vagina opening. Inside the vagina opening, about 8 cm, 9 cm, this is the cervix. Inside the ovary, there are many small follicles. All right. Okay, this is I want to teach you about the menstrual cycle. From the first day of the period until the next cycle of the period, one day before, this you take average by 3 months, this is your menstrual cycle. This menstrual cycle divided into 2 parts, all right? You have the follicle phase and also the post-ovulation phase. At the center is the ovulation. All right. During the first day of your menses, the ovary will recruit about 20 to 30 eggs. And these eggs will actually mature and enlarge, but only one will end up as a matured egg to be released by your body and of the ovary. All right. If the sexual intercourse happen during your fertile period, when the egg is released from the ovary, the semen was sperm will swim from the vagina into the uterus, fallopian tube. This is where at the fallopian tube, which is where the egg is fertilized by the sperm. It takes 5 days for them to reach back to the uterus. All right. After the ovulation, it becomes an eggshell. This eggshell will persist for another 10 days. If you're pregnant, it will persist until 10 to 12 weeks. If pregnancy doesn't happen, all right, this corpus luteum will degenerate. This is the ultrasound features of the matured follicle. All right, this is our menstrual cycle. All right, menstrual cycle varies from day 21 to day 35. All right, every lady's varies. All right, how you count your fertile period? It is 14 days from your first day of your last period. For example, if my menstrual cycle is 28 days, then my ovulation is about day 14. If my menstrual cycle is 30 days, then my ovulation date is about day 16. All right. Sometimes one day earlier or one day later. All right. If you have an intercourse during the ovulation or fertile period, then you are most likely to get pregnant. All right. This is that should show you that the fertilized eggs take 5 days to reach the womb. When they reach the womb, the fertilized embryo will come out from the shell and they start implant on the wall of the uterus. All right, this is the uterus. Uterus have 3 lining: outer lining, muscle, and inner lining. If you are not pregnant, then the inner lining will shed together with your menses. All right. If you are pregnant, this lining will persist until the day of delivery of your child. This is the menstrual cycle, as I mentioned just now. It is divided in 2 parts: follicular phase and post-ovulation phase. All right. In the center is where your fertile period is. Normally, the menses can last from 2 days to 7 days. It varies from one lady to another lady. Okay, this is ultrasound scan of your tummy. All right, you can see that this is your skin, this is the fat. You can reach, this is the intestine. You have bladder, uterus, and also bowel. This is the lateral view. This is the bladder. The whole thing here is the uterus. The lining inside this is the endometrium lining, the inner lining of the womb. All right, again, this is another ultrasound, same. If the abdominal ultrasound is not clear, or the patient is obese, or the contrast is not good, so sometimes you'll do a vaginal ultrasound. Okay, as you can see, this is the uterus. If you just pass your menses, the lining is likely to be thin. However, if you are near ovulation, the lining will be a triple line. After ovulation, then this thing will transform, then become a luteal phase of the endometrium. During the vaginal scan, you can see that this is the ovary. There's a lot of small follicles, yet this is yet to be matured, yet to be released and stimulated by your body. This is a matured follicle. If you do IVF, there's about 10, 20, even 30s of eggs. All right, but however, if a natural cycle, then there will be only 1 egg. Very rarely you have 2 eggs. If there's 2 eggs, you will end up as a twin. Okay, this is the reproductive organ of the male. This is the testis where the sperm is produced. This is epididymis, where it is a warehouse of the sperm storage. And this is the vas deferens, where this is the transport pipeline. When during the arousal, during the ejaculation, the sperm will come out from the warehouse into this tube, transport tube, then into the exterior part of the body. All right. Normally, we'll do a semen analysis. This sperm production, if there's 100 sperm, only 4% is normal. Some, about 96% of that is abnormal. Some has big head, small head, two tail, and abnormal sperm. All right. So it's important to analyze the semen or the sperm when the couple has infertility problem. This is just want to show you that the importance of the fertilization. The ovary release the egg. So then the female will pick up the eggs. So during the ovulation time, so if there's an intercourse happen, the sperm will swim to the uterus, to the fallopian tube, and fertilize the egg. So once they fertilize the egg, it takes about 5 days, all right, to come back to the uterus and implant on the uterus. All right, from the fertilization to a baby, it takes about 38 weeks. From the first day of your menses, it is about 40 weeks. So for the sperm, who reached the egg first, who is the winner? All right. Okay. Normally, a stronger sperm will fertilize the egg. So this one to tell you that the average time to get pregnant is about 3 to 4 months only. All right. So when you age, this is a group of the age of the patient, and this is a pregnancy percentage. As you age, the likelihood of you not getting pregnant is actually become higher and higher. The likelihood of you not pregnant is also higher. So this is the follicle inside the ovary. So when you are born, there are about 2 million of small eggs inside the ovary. As you age, so the number of eggs becomes smaller and smaller. So does the quality. All right. Each menstrual cycle, the ovary will recruit about 20 to 30 eggs. All right. This immature egg, only one of them will grow into a big follicle and yet to be released during the ovulation. This is to show you that AMH anti-malarial hormone, this is the hormone released by this primordial primary follicle. All right. As you age, the hormone actually become reduced. All right. So when is the best time to have sex? So basically, it's 14 days from your first day of your menses. So you take that into 3 months of account. All right. So if you have 28 days of it's a menstrual cycle, so you minus 14 days is about day 14 your ovulation. All right. You 30 days, then the ovulation happened at day 16. If your menstrual cycle is 34 days, then the ovulation happened at day 20. All right. You can choose if it's the day 28, the ovulation happened at day 14. So we can either have a sex day 10, day 12, and day 14. So majority will focus on day 12 and day 14 because this is the ovulation day. Or you can choose either day 11, day 13, and day 15. So if you want to try do an ovulation test kit, then you will tell that whether you are actually fertile. All right. You know this is the maximum line, so you should dip not to dip this line into the urine. The urine should be below this level. All right. If there's 2 lines that indicate that you may having ovulation soon. If it's just 1 line, then it's actually negative. Then you can continue testing. You can test twice per day, 9 o'clock morning, 9 o'clock evening. All right. So when the test become positive, that means you are about to have an LH surge, and the ovaries are yet to release the eggs, and you are considered fertile. So if you are not release your egg frequently, or your cycle it doesn't release eggs, you can use some medication to help you with the recruitment of the eggs. All right, then same thing, we can do a LH test kit, or we can target on your fertile period, and we have an intercourse during your fertile period to increase the likelihood of pregnancy. There's a condition called polycystic ovarian syndrome, whereby this ovary, there's a lot of immature egg. This is you are born with it, all right? But in the normal ovary, there are not many eggs as many as the PCOS, all right? So if you, the ovary is inside here, got a lot of eggs, you can see that in normal circumstances, the hormone that consists of up and down. However, in PCOS, it's just a flat line, so that the ovary, inside the ovary, the eggs will not mature. So I want to tell you that the fertilization happens at the fallopian tube. So what happens if the fallopian tube is blocked? So that means the sperm will never able to fertilize or meet the eggs to fertilize the egg. So we need to do a test called hysterosalpingography. So this is a dye that is injected into the womb. So we will take the X-ray. So at the same time, you will see that there's any flow into the fallopian tube. So if we want to test whether the fallopian tube is there any blockage. Or sometimes we can even do saline hysterosalpingography. That means during the ultrasound, some of the fluid is pushed inside the uterus to test the tubal patency. All right. Now we come into treatment. So there's one treatment called IUI or intrauterine insemination. That means that we'll pre-treat your husband's sperm. All right. During your fertile period, with or without medication, we can put the tube inside the uterus so that this sperm is actually nearer to the ovulated egg. All right. So because of this, it increases your chance of getting pregnant. The fertile medication also may increase the number of eggs to be ovulated from 2 to 4, compared to 1 only during each menstrual cycle. This is another view. You give us the sperm, we'll process it into the lab and pre-treat it so that we will choose the active sperm, and this active sperm to be injected into the uterus while awaiting for fertilization. So timing on insemination also can be done through the LH test kit or just through ultrasound alone. So now we move on to IVF. IVF, this is our standard protocol. Normally, a ladies will undergo 10 days of injection. All right, they'll come at day 2 of their period, stimulate for 5 days. We'll repeat a scan. We'll titrate the dose of the medication, whether to go up or go down. Then we'll introduce another medication to prevent premature ovulation or the egg to be released by the ovary. All right, at day 9 or day 10, we'll decide when to do an egg pickup. I will explain in detail later. So the husband will will give us a sperm. We'll help to fertilize the egg. So we'll culture the fertilized ovum into day 2, day 3, and day 5, even day 6, then to be transferred back to the womb. So a standard protocol is 10 days of injection. Then we introduce another injection from the day 6 onward, normally about day 12, day 13, all right, when this follicle inside the ovary grow into a certain size and matured, then it's time to harvest the egg. So normally you will grow about 1 mm until 10 mm, then 2 mm after 10 mm. Then after that, we'll measure the follicle. If they are 18 to 20 mm, they are considered matured and ready to be harvested. So how do we harvest? Normally we'll do a vagina scan. Then we'll put a long, very fine needle to suck out all the egg yolk or the ovum. All right. So this is another picture into a test tube. That's why it's called a test tube baby. So the ovum all will be sucked out into a test tube. Subsequently, we will actually fertilize the egg. So we'll put the eggs inside this petri dish. So we'll drop few drops of sperm, which is about consists of 400 to 500,000 of sperm. This sperm will fertilize the egg. Then we transfer back this fertilized egg into the womb after 3 to 5 days of culture. So this to show you the fertilization happen by itself. This is show you, this is a classical one. All right, this is ICSI, where the sperm is weak, is injected directly into the egg itself under this micro manipulation system, 200 to 400 times of the microscope. So this is a conventional one. You put a petri dish, the eggs in the center, about 500 of sperms. So you culture it for 3 days until 6 days. Then you transfer back this embryo into the womb. Then waiting for pregnancy to happen. So if the sperm is weak or for some other reason, so you can inject the sperm directly into the eggs under this micro manipulation system. So from fertilized egg to baby, it takes about 40 weeks. All right. Do you realize that from fertilization to 5 days, fertilization, it takes about 5 to 6 days for the egg, fertilized eggs or embryo to reach the uterus. So that's why we're transferring back the day 5, day 6 embryo back into the womb. So this is to show you that some picture of the eggs, fertilized egg. This is fertilization happen. Then it's split into 2, 4, 8, 16, 32. Then this is called blastocyst, where there's about 200 to 300 of cell. All right. So this is day 1, day 2, day 3, day 4, and day 5. Anything less than day 5 is called embryo. Day 5 is terms blastocyst. So you will know that I told you just now, if the lining inside is triple line, then your womb is considered receptive to baby. So we can actually consider doing a fresh transfer for you. So that means that after culture, you put back the baby inside. All right. So normally it's culture inside this machine here. It's called incubator. It has an environment mimic the fallopian tube with 5% of carbon dioxide, 5% of oxygen, 90% of nitrogen, and a humidity of 100%. So how do you choose the embryo? Based on whether they have fragment or not, whether they look nice or not, or whether they're genetically normal or not. So there's so many eggs, which one to choose from? All right. So normally we'll look at their morphological, the outlook of these blastocysts, the outline, the inner cell, and the expansion of this embryo, whether they are good or not, or during the division, is there any problem or not? All right, or we can do through a genetic screening, or we can do through a testing the waste product secreted by this blastocyst or embryo. So normally we will choose the blastocyst because the strongest remain. All right. So the others will phase out if they are not good. If the quality is not good. So it takes 5 days to culture them, up to 6 days. Then we'll put back inside the womb. So if the stimulation and also the embryo transfer happen together, then we call it fresh transfer. The extra egg that we have collected can be frozen, a fertilized egg that can be frozen and for future use. In future, we will just take out from this liquid nitrogen, we will thaw it, then we will do a transfer, then it's called a frozen embryo transfer. That means that after the stimulation, we can either go for fresh transfer or frozen transfer later on, all right? Or fresh transfer, the rest of the embryo can be frozen for later use. If you are not pregnant or after delivery, we can do another transfer. So we can put a catheter inside the womb. This catheter inside contains maybe 1 or 2 blastocysts or sometimes embryo. So if you wait for 2 weeks, then you can have your blood test done. Then you know that whether you're actually pregnant or not pregnant. So in conclusion, I told you that the step involves consultation. You do some baseline workout and ultrasound. You have 10 days of stimulation. Then you have, when the oocyte is matured, then you're actually ready for egg harvest. So during the egg harvest, husband need to give us the sperm so the eggs can be fertilized. The fertilization can happen by a classical fertilization or ICSI fertilization. So we wait until from 2 days until 6 days. If the embryo is mature enough, then we can transfer back to the womb. All right. If the embryo is frozen, you can thaw it. Then you can do a frozen embryo transfer. You wait for 2 weeks. Then you do a pregnancy test whether your IVF is successful or not. So because of this freeze-all policy, a lot of these patients with IVF, they have a risk of the ovary hyperstimulated due to the hormone injection that we have gave, which lead to the lining inside the womb become less receptive to the embryo or to the blastocyst to implant on. That's why a lot of center, now they do a lot of freeze-all policy. All right, this is how you choose. You either can choose on the outlook of the embryo, or you can do some genetic testing. How you do some genetic testing? You can do some laser to create a hole. Then you can take out 3 cells from this blastocyst. This blastocyst normally consists about 200 to 300 cells. So you require to take 3 to 5 cells from this blastocyst for genetic testing. So this embryo selection is actually very highly subjective. It's based on their shape. So if you want to be objective, then you need to do a genetic test. All right. Then this a marks is given to this embryo during their development, during their culture. However, this scoring is normally very static. How do you apply a static scoring in the dynamic process? So it's very difficult and it's very subjective. So normally it's put inside this incubator. With the new technology, there's something called timeless embryo imaging. This is like this machine. However, there's a CCTV which observe the cell, whether they looks good, how during their division, is there any problem? All right, so that we can backtrack, that we can play the video, whether this embryo whether they are healthy or not. This is another one, so that we look for highest potential and lowest risk of miscarriage or fetal defect. And this embryo or blastocyst can be transferred back to the womb, so that reduce the risk of miscarriage. I just want to show you that everyone have a 46 number of chromosome. All right, we are made of many organ. Inside this organ, there's a lot of tissue. This tissue cell is actually made out of number of cells. All right, inside this number of cells, there's a lot of chromosome. Chromosome consists of DNA, and also DNA consists of millions of genes. All right, so this is to show you that the ladies contribute about 23 chromosomes to the baby. The male also contribute 23 chromosomes to the baby. So a total of 46 chromosomes or 23 pairs. If it's a boy, then it will be 46, including the sex chromosome is X and Y. If it's a female, 46 chromosome include the X chromosome. There's a double X chromosome here. For male, it's X and Y. For female, it's double X. So we can do a genetic testing on the embryo itself. So this is to show you that as we age, the number of the embryo that's normal actually become decreasing. As simple as that. So if you age, all right, if you're less than 35, you require 8 embryo in order to have 1 normal embryo. If your age is between 35 to 39, you require 10 embryo to have 1 normal embryo. However, if you are 40 to 42, then you require 17 of this embryo in order to have 1 normal embryo. Can you see that? So this is to show you that this is to show you the impact of the biopsy. If it's done too early, that's not good. Normally, if you done in day 5 at the blastocyst stage, there's not much difference between the biopsy and this is the non-biopsy and biopsy. If you done at day 3, all right, that means if you done 10, so that means 7 of them, 39% of them will get damaged. This is to do a chromosome screening, whether they have number of correct chromosome, 46XX or 46XY. So this is to show you that if the cell split, sometimes they may not get what they want, and correct number of chromosome. If it's not 46XY or 46XX, then it's considered abnormal. All right, you see implantation without chromosome. So it's about when you age 35, this is 35 to 37, this is 38 to 40, this one 41, 42, and this is above 43. So the implantation, which is the blue one with no chromosome or genetic study, so it become reduced from 52, 38, 21, and 5, and even 1%. However, if you do a chromosome checking, so you'll be consistently at 65 or 63, 63, and 63%. And on the other hand, the aneuploidy, that means not 46XY, the number of abnormal chromosomes actually slowly increase as you age. So pre-implantation genetic testing, or we call it PGS, is a procedure to analyze the embryo, whether they have a normal genetic before they are transferred back to the womb for implantation, for pregnancy before it occurs. So PGS offer a couple risks of unaffected child without facing risk of termination if the baby turn out to be abnormal. So do I need a PGS? So if you are aged more than 40, you have recurrent miscarriage, and you have multiple IVF attempt, or you have a previous child with genetic abnormality, then I recommend you to do a PGS. All right, normally a PGS is run through this machine. It's called next generation sequencing. So this machine will pick up the signal from the chromosome genetic material. All right, this is a normal chromosome for XY, normal karyotype. You have 46XY or 46XX. All right, if you count them, there's 23 pair, or if you count them one by one, there is total of 46. So in a Down syndrome, all right, this is basically a genetic problem. All right, there's a 3 chromosome 21, leading to genetic inheritance abnormalities. So if you're aged at 20, there's a 1 in risk of 2,000. If your age is 30, the risk is 1 in 900. If your age in 40, it's 1 in 100. So as you age, you see the risk of Down syndrome increases in every pregnancy. So after the PGS, we call something called PGD. PGS is like a dictionary. There's 46 books of dictionary. But PGD will tell you at which page, which sentence, which paragraph have problem. All right. For example, this is the example. PGS will tell you how many books are there, but PGD will tell you whether inside the books the page went missing, or the paragraph went missing, or there's additional information inside. All right. A common example of doing PGD is thalassemia. All right. 1 in 20 Malaysians are the thalassemia carrier. Thalassemia major consists of 1.5 millions of Malaysians. Most of them is Chinese. All right. The bone marrow not able to produce normal red blood cell. So this child normally will require a regular blood transfusion every month to every 6 weeks. So if both parents are carrier, all right, there is a chance of 25% will actually transmit to the child. The child have a risk of thalassemia major. So if both are carrier, 25% is normal baby, 25% is the full-blown thalassemia major, and another 50%, so the baby is actually a carrier. All right. On another hand, if only one of them is a carrier, so what happens is 50% is a normal baby, 50% is a carrier. All right. So what this one just to show you, if you do PGS, the success rate can jump from 41% to 69%. This is with one baby. If you transfer baby, it can even go up to 75%. All right. Let's say this is the blastocyst. All right. There's 7 of them. After PGS, only 3 of the blastocysts is identified to be normal. 4 of them is abnormal. So basically, you have consists of 3 chances of doing a embryo transfer, and it also improves the chance of success IVF. So if you have 10 eggs, so you have 10 eggs, after fertilize, you only have less than 4 embryo. Then I recommend you do a fresh transfer or frozen transfer later. However, you have 4 embryo, all right? So we will further culture it, and we will do a genetic testing. Let's say it's more than 2, we can actually do a PGS. So latest technology is what I've spoken to you just now is time-lapse monitoring. That means putting a CCTV inside the incubator. Then we can do a PGS through next generation sequencing. if there's an inherited disease, such as thalassemia or other weird disease, then we can do a pre-implantation genetic diagnosis. You want to confirm whether the baby is having this disease or not. All right. Or we can do something called non-invasive chromosome screening. This is based on the waste product that the embryo or blastocyst is secreted. So this waste product consists of this the genetic material yet to be analyzed. Then there's also something called IMSI, intracytoplasmic morphological selected sperm. If the sperm is very poor, you want to select the best sperm through, you want to enlarge it many times, choose the best sperm and inject it into the eggs. This is to show you, and next is called non-invasive chromosome screening. Normally, you will do a biopsy on the blastocyst. All right, through this classical and ICSI, you culture it for 5 days. You'll do a biopsy. However, this biopsy may injure or may damage the blastocyst. All right, with the new technology, I can culture this blastocyst inside this petri dish. This fluid may consist of this genetic material secreted by this blastocyst. Then we can further do a genomic DNA study and next generation sequencing on the waste product secreted by this blastocyst. Then we can actually see whether there's a genetic abnormality on the blast. Or normally we actually enlarge it 400 times. However, with a lot of sperm, if they're abnormal, we can enlarge it 6,000 to 7,000 times. We'll choose the best sperm, inject it directly into the to the ovum. So IMSI is basically used if the male have a lot of sperm deformity, or the couple have a lot of multiple miscarriage or failed implantation. Why we do IMSI? Because you want to increase the fertilization egg, you want to get a good quality embryo, you want to increase the pregnancy rate and the live birth rate, and of course reduce risk of miscarriage. Okay, we also can do fertility preservation. Nowadays, a lot of people do egg freezing, social reason or medical reason. All right, if you are married, then you may want to consider doing embryo freezing. All right, especially if the patient has a lot of have a history of cancer, want to undergo surgery, undergo a radiotherapy, they may consider an ovarian tissue freezing prior to the cancer treatment. Thank you very much.
Okay, thank you, Dr. Tan, for his sharing. And thanks to those that are still with us. Currently, we are open for Q&A sessions. You may drop your questions and we'll get Dr. Tan to reply your questions. So while waiting, probably I start with my question. So usually as a doctor's experience, what you can advise for a couple that they should decide to go for fertility doctor consultations?
All right, if the lady is age below 35, has been trying for more than 1 year, they should consult a fertility doctor or gynecologist. However, if they are more than 35, have been trying for more than 6 months, then they should also consider this. Earlier, if they have pre-existing medical problem or gynecological problem, for example, fibroid, cysts, and etc.
What is the age limit for IVF?
Oh, basically the age limit is 45. After 45, the ovary, the follicles or the ovum may not be have sufficient. If they do, a lot of abnormal genetic risk will be involved. So patient with 45, 45 and above, we normally will encourage do the ovum egg donation. All right. We also encourage ladies to freeze their eggs before age of 35, and this egg can be used later on.
Oh, that's the reason why there's a services that requires suggest ladies to actually go for ovum freezing.
Yes, you can protect your egg quality and numbers. All right. So if you're career minded, then you are keen to engage in also pregnancy after the age of 40. So it's better to preserve your egg in advance. Or if you haven't met Mr. Right, for example, so it's better to freeze your egg. All right.
Okay, I understand. So there's a second question from the floor is that actually what happens to the eggs if not used during the IVF section?
What happened to the eggs if it's not used during the IVF section? Okay,
Yeah.
some of the eggs, they will degenerate. Okay, let's say I have 15 eggs, all right? Normally about 8 or 9 of them become day 3 embryo, all right?
Mm-hmm.
About 5 to 6 have become a blastocyst, all right?
Mm-hmm.
So it's just like climbing a mountain, all right? You have a highest peak like Himalaya, for example, all right? The strongest one will always, the one who reach the top will be the strongest, all right? They are the likely to have a successful pregnancy. So if there's a lot of eggs, then we will challenge them into a day 5 or day 6 blastocyst, all right? However, if there are not many eggs to be around, so normally we'll freeze them about day 2 or day 3 because there's not many to choose from. All right.
Okay.
Now we're talking about the extra of the embryo, what to do with them. We actually can freeze them under liquid nitrogen. You can freeze them 10 years, 15 years. Then when we feel like getting pregnant, we can actually take out the embryo from the liquid nitrogen. Then we can just thaw it. Then we'll give some medication for the mother to take, all right, to prepare the womb lining, so the womb become receptive for the baby. So we'll transfer back this baby into the womb, all right?
Okay, there's also a questions regarding how long can those frozen eggs can be kept? I think regarding the ovum storage lah.
All right. Normally, we encourage up to 10 years, all right? Okay.
Oh, okay.
If you wish to further extend it, of course, depends on country. In Malaysia, we do. If you want to extend more than 10 years, we allow you to do it.
Okay. Okay, come back to my questions that press. Does husband health condition can be one of the cause of the infertility? I think yesterday there's a news regarding infertility rate about asking the men to concern about the sperm conditions. So that's why I come out. Is husband health condition is part of the cause for the infertility nowadays?
Yes, a lot of men actually, there's two concerns. One is genetic concern. The other one is actually men's health. For example, these men have, let's say, a testicular cancer. You may want to freeze the sperm first before the male partner engage in a chemotherapy, radiotherapy, or even surgery. All right. So other than that, it consists of your diabetes, you are having a high blood pressure, you smoke or you drink. This may also affect the quality sperm also. And of course, a lot of lifestyle involved, like you have a good sleep rhythm, all right? Then you have to take more vegetable. If you take a lot of fast food, a lot of processed food, there's a higher chance of your sperm become abnormal. These are actually basically due to pollution, all right? And also the chemical ingredient inside the food. Also insecticide and also pesticide.
Okay. Okay, let's continue for my next questions. Sorry for that, I've just the lie a little bit that. So is it IVF treatment the only option for couple to have higher chance of getting is it the only option for IVF? Because just now Dr. Do say about few selection, few choices.
Hello. Basically, IVF is not only treatment for an infertile couple. I think we need to. Hello. I think we need to. I think we need to individualize each couple about fertility treatment rather than to give them just IVF. All right. Not everyone require IVF actually. All right. Okay. Some may just need some reassuring, especially if they are 35 and below. All right. You may just ask them to carry out with the intercourse during their fertile period. Some may only take some medication to increase the ovulation. All right. If sometimes it will require intervention, you can do IUI, intrauterine insemination. All right, this is especially when the fallopian tube is still patent. All right, if the fallopian tube is blocked, that means the sperm will not be able to meet the eggs. So in this kind of condition, normally patients require IVF, or sometimes there's a severe male problem, or it's also require IVF. All right.
Okay. Okay. How about is there any side effects associated with IVF?
All right. The side effect include bloating, especially you are given so much hormone, constipation, breast pain or tenderness. All right, mood swing, headache. All right. Very rarely, about less than 1% have overstimulated problem, ovarian hyperstimulation. This includes vomiting, severe tummy pain, all right, bloating, difficulty in breathing, and also rapid weight gain within few days. This is due to the water retention, and this fluid is normally lost in the third space, all right, normally in the organ, all right, rather than inside the vessel. Other than that, the risks include during the procedure, there's a risk of bleeding, infection, also injury to the visceral organ, such as bowel and also the bladder. All right. Other than that, there's a risk of multiple pregnancy. That means there's a 20% chance to become pregnant with twin, 3% chance of getting pregnant with 3 baby or more. All right. Other than that, increased risk of ectopic pregnancy, that means the baby is no longer inside the womb, it's actually at the fallopian tube. All right, this is an emergency operation condition.
Okay, let's check out is there any question. So any actually candidate that is not suitable to do IVF treatments?
All right, if the patient is not suitable of getting pregnant, then the patient is not suitable of having IVF treatment. All right, this is very rare. For example, they will have a severe heart problem, normally congenital, or they're mentally ill, or they have a cancer such as advanced cancer, breast cancer, liver cancer, brain cancer. So these are the candidates that are not suitable to get pregnant, hence IVF. All right. So there are not many contraindications of doing IVF. Hi, thank you everyone. Thank you for attending this Erufu live talk. I'm Dr. Tan. I'm from Ever Link Fertility Center. We wish you well and also successful in conceiving a baby. Thank you. Thank you so much.